Hello, everyone, and welcome, and thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we are talking to Steve Klahn, who is the System Clinical Director for Virtual Medicine at Houston Methodist, about why the next generation of nursing roles will be virtual. So, hi, Steve, how are you?
Hi, good morning. Doing great. Thanks for having me.
Yeah, of course. Thanks for taking the time. So let's jump right in. I wanted to ask you right off the top, if you had to guess, what percentage of nursing positions across the industry do you think will become virtual or have some kind of virtual component within the next 5, 10 years?
I'd say well over half. I'd say probably 60 to 70%, just with
Hmm.
the massive kind of growth and expansion over the last 2 years.
Hmm.
And seeing that this is going to stick with us for a while, understandably so, because there's such positive kind of response to programs that are engaging a virtual component or fully virtual. Yeah.
Hmm. What are some of those positives?
Yeah, so I think we're seeing and we've published our experiences here at Houston Methodist with reductions in nursing turnover, nurse
Hmm.
satisfaction. We are seeing patients having improved throughput in terms of timeliness of discharge, a specific component of that discharge process. The patient experience, they're really enjoying kind of dedicated one-on-one time with a live, experienced, empathetic nurse that's interacting with them and taking their time through either their admission or their discharge.
Hmm.
And so the patient experience is looking great. And administration is loving it, obviously, too, with the fact that turnover rates seem to be really, really softening and contract labor is really reduced or eliminated in most instances.
Absolutely. So, what do you think the standard care model for nursing will look like with virtual platforms incorporated into it?
Yeah, I think it's a great question. I would say, it's going to be comprehensive in nature. It's going to be highly integrated, not only task-driven type support from remote nurses, but also too, I think the traditional way of capturing vital signs, right, with technicians and folks going in to check blood pressures and heart rates and respiratory rates and all those types of things,
Hmm.
with biosensors and different types of remote patient monitoring devices that are out there, some more invasive than others. But really being able to get that data in an automated way
Hmm.
to be able to synthesize that both through a software system, but also to experienced clinical personnel that are remotely supporting bedside teams. I think those are the kinds of things that are really kind of changing the way the landscape of patient care. And I think you'll see more and more. We're seeing numerous institutions around the country that are sharing their experiences with that truly comprehensive model where you're seeing paired nursing teams like at different ratios than traditional, right? Being able
Hmm.
to have folks on the ground taking a large group of patients and then moving a good portion of their workload over to that remote nurse that's able to help load balance a larger group of patients. And so instead of having a discharge nurse assigned to each unit or even spread between two units,
Hmm.
we would sometimes have patients getting stacked up um, um, waiting on that nurse to be available to come do their discharge instructions. Now you can actually have one or two nurses supporting a much larger group of patient populations and truly load balancing and taking those calls as they come in and reducing the wait times for that process. And as long as you get the integration points designed right, where you keep clinical workflows very, very simplistic in nature and make sure that you leave that expert clinician populating those patient specific discharge instructions. Um, um, that responsibility for that bedside nurse and then shift over that kind of time consuming but very, very important dialogue with that patient, but back and forth going through those important discharge instructions. That seems to be a successful model that we've seen.
Absolutely. And earlier you mentioned turnover rates being lower. So how do you think virtual nursing will impact staffing in terms of like flexible scheduling or as a recruitment tool?
Yeah, yeah. I think immensely. I think really depending upon scheduling for not only the virtual programs but also to the bedside teams. And as we kind of look at activities of support that are needed for our patients, right? Balancing
Hmm.
that with the old model of having the exact same ratio day and night, 24 hours a day, and everybody working those rigid 8 or 12 hour shifts, especially in our virtual world, we're doing a different type of an approach for that, where you have hybrid workforce and you have 8, 10, 12 hour shifts, higher frequency if they're doing more task-based activities like our nurses are doing. So they do 11 a to 9 p, or we even have some folks that are doing 3 p.m. to 3 a.m. That's kind of one of those ER shift times. We would never want somebody driving home at 3 a.m., but if they're doing a work from home rotation, that's a real
Hmm.
popular shift. And so again, I think making sure that we're not building a model that's so rigid in nature and focused around the team that's providing that service, but more around the needs of that patient and the frontline teams. Building that model to where it's in line with where those needs are. Hopefully
Hmm.
that answers that for you.
Yeah, absolutely. And what are your thoughts about virtual nursing as a retention tool for more tenured nurses?
Oh, 100%. I think not only the more tenured, but the folks that just might need a break from the bedside, whether they're burned out or just,
Hmm.
really stressed. I think it's even if you build something that has a hybrid workforce where you rotate nurses into this virtual environment. We do that in some of our other programs, like our virtual ICU or tele ICU.
Hmm.
But these virtual nursing programs, same type of setup you could do, where you rotate folks in, but we're able to facilitate, obviously, bringing in staff members that have the intellectual capital, but maybe their physical limitations, either due to age or injury or health concerns, right, are able to kind of quickly pick up the environment. Again, keeping those workflows and the technology really, really simplistic in nature, and really riding heavily upon that nurse's experience in communicating with that patient family, other clinical staff, right? In the most opportune way. So teleproctoring and mentoring, right? Like those are skills
Hmm.
that you don't need touch necessarily. Yes, you might for helping with an IV or something of that nature, but with the camera tools that are out there and the different kind of tech stacks that are coming out, you'd be amazed at what you can kind of proctor and mentor remotely. And especially with that more experienced nurse, back to your question, right? Um, um, if we could shift gears a little bit and partner more with the education environments, and we're doing that actually. We're starting with some partnerships with our local nursing school to kind of get into their sim lab and familiarize nursing students, right, with this new type of technology, not only from the, hey, here's how vital signs are being captured now, but also to like, here's these integration points that virtual teams kind of bring to the table. And some of those things might be like remote patient monitoring, like I mentioned earlier, or dual sign off of medications, or one of our sister hospitals in the Texas Med Center here is doing remote blood transfusion monitoring. And so I think the sky's kind of the limit, right, with all the different activities that can be supported remotely.
Hmm. Absolutely. And what are your thoughts about virtual nursing as a way to kind of offset travel nurses? I've heard y'all maybe had some success with that.
Oh yeah, no, absolutely. At our primary quaternary campus, over my shoulders here in the Texas Med Center, it's about 1,000 bed hospital, and we were able to eliminate contract labor in all inpatient environments pretty
Wow.
quickly. Um, we don't know that there's a complete direct correlation with our virtual
Hmm.
nursing program, but it happened to coincide with the timing of us
Hmm.
installing it. And when you pair that with a large survey that we again published in a peer review publication that talks about how we really raised nurse satisfaction by bringing this program to our bedside nurses. And we even shifted ratios in one of those hospitals, right? The nurses still love it. They really, this is not one of those programs where you have to kind of really drive it and push and build policies and procedures to force people to use it.
Mhm.
Nurses use it because they love it. They enjoy being able to have that kind of helpful hand. That again kind of takes a little bit of the load off of their very busy shoulders, and allows them to do those equally important or more important physical touch and empathy with the patient and those hands-on types procedures that might can do.
Absolutely, yeah. I'm loving hearing from a ton of the different, CNOs and nurse leaders that I'm talking to about how much the nurses really do love the virtual nursing model. That's a really good sign, I think.
Absolutely.
Um, yeah, so my last question for you is what advice do you have for CNOs or other nurse leaders who want to help their workforce adjust to having a virtual nursing model?
Yeah, I guess no rocket science here really, other than first and foremost, don't be afraid to try it, right? There's enough people that have kind of taken that deep dive and shown the positive outcomes. But sometimes that biggest hurdle is making the decision to say, you know what, we're committed to this. Let's give it a whirl. I think engaging the frontline team as quickly as possible. From that moment in time, you guys can make a decision strategically, right, to embark upon this type of a program. Engage not
Hmm.
only that frontline leader team, but we sent out a survey to our frontline nurses. Very, very simplistic. Help us prioritize the top 4 items out of this list of 25 things that we think we can offer virtually, right? And immediately they showed us, and when I say they, the bedside nurses,
Hmm.
with the voice of the bedside nurse in a magnet institution, we've got to rely on that front line to help prioritize these types of things. And
Hmm.
then build the simplistic workflows behind that, and make sure that you don't have excessively long, lengthy handoffs and processes that would prevent or preclude people from utilizing the service. And I think that's where you see our growth rate. We had peaked at almost 500 patient encounters a day with admissions and discharges just last week.
Oh,
We're
wow.
doing over 10,000 a month here, and we're 2 years into the program, but the incremental growth without bringing a ton of new units on has just been commendable, I think, for the team and the service. And I think it's a testament to um, that very first kind of process with the voice of that frontline nursing team to help drive something that they would like to use. And yeah, I think it was super important. The other thing I had was on the tech front, don't be scared of that as well too, right? You can try something that you already have, whether that be an iPad or if you have some existing parts from some other technology that you're using for some other type of telemedicine service.
Hmm.
But don't feel like you have to hardwire everything in. Ultimately, that is probably the best way to go long term, where you don't rely on somebody to physically have to connect an iPad to a network or physically move a card around. But those can be expensive. But if again, if you're piloting, you're trying it out, testing the waters, feel free to use kind of your existing tech stack and see what you can piggyback onto with the program. But don't let it get in your way. Don't overcomplicate that. Again, super simplistic. Find some way to have if you're an on-demand type service like we happen to be, whether that be a button for folks to push or a phone call or an email or Epic secure chat type of messaging. Again, keep things as simple as possible, and it would work really well for you.
Absolutely. Well, thank you so much, Steve, for your time. I'm really grateful to have had this opportunity to hear your insights, and thank you so much to our audience for listening.